The Constitution of Kenya provides a framework for ensuring comprehensive and people-driven health services through a rights-based approach to health in the country. It further states that every citizen has a right to life, the right to the highest attainable standard of health including reproductive health and emergency treatment, the right to clean, safe and adequate water and reasonable standards of sanitation, and the right to a clean, healthy environment. To the people of Matisi slums, these remain lofty aspirations they can hardly relate to.
This area that they are living, it's very poor and it has a lot of challenges and mainly health issues.
Na watu wetu wa Matisi population iko almost 50,000. Na watu wengi hawajiwezi. Watu wengi wamekodesha nyumba, ni wale wanafanya biashara ya businesses zile ndogo ndogo, wengine wanaenda casual works, wengine hata wanaenda kufulia watu manguo ndio wapate chakula cha siku. Watu wengi wetu wanahangaika kwa sababu ya umaskini.
The quality of basic health services is extremely poor and they face many barriers to accessing healthcare. Matisi and Kipsongo settlements are characterized by overcrowding, poor infrastructure, and inadequate social amenities. Access to clean water, sanitation, and hygiene in the slum area is below the minimum standard recommended by the World Health Organization.
The poverty level is high, and Kitale, since it's a one hospital within this region, is also congested.
The nearest healthcare facilities in the area are over 20 kilometers away, and those facilities lack modern equipment for the diagnosis and treatment of common ailments.
I've advised them in terms of structure and the standards of the government of Kenya, how a level 3 should look like. Trans Nzoia County does not have a good radiology department for those specialized tests, for example CT scan.
Hakuna hospitali ingine iko karibu. Tuko na public hospital ambayo ni Grassland Hospital. Tuko na ingine inaitwa Tomboya ambayo ziko mbali.
Matisi iko na dispensary moja, Rafiki ni mbali, lakini hapa hatuna. Kwa hii katikati hapa tunafurahia, itasaidia watu wengi. Hata kama ni uwezo ikuwe na maternity, isaidie wa mama kujifungulia hapo na watu wapate matibabu.
And the health facilities that are there, it's quite a distance to get there. The women felt were asking sisters now and then whether those sisters who came from the dispensary of the sisters in Meru, they would come, help them and treat them.
The lack of adequate healthcare personnel in the government facilities in Trans Nzoia and the frequent unrest among the healthcare workers have continuously been cited as barriers to a functional and dependable health system in the area. The community, with an estimated number of about 50,000, is greatly burdened by disease like malaria, tuberculosis, HIV and AIDS, and respiratory and diarrhea, which are major causes of morbidity and mortality in these urban slums.
Some of them, they have lived with health issues, underlying factors like blood pressure, diabetes, and even their children were getting sick and they have been sick. And to go to the hospitals, it is quite a distance.
The Good Shepherd Sisters have taken steps to ensure that Kipsongo and Matisi community is not left behind in the journey towards better health. The target is to ensure that going forward, fewer women are dying from complications associated with pregnancy or birth. More children are growing up strong and healthy, and the community have a modern, functional healthcare facility. These are the reasons that necessitated the proposal to build a modern healthcare facility in the location. The hospital is set to thrive on the firm foundation laid by the many years of community empowerment work done by the Good Shepherd Sisters.
So with this, we have felt that despite the fact that we are working with women and children, we also look at their health. And this we feel it will bring about a holistic growth, because even with the health, we are going to reach out to children in school, we are going to reach out to women in their families and in their houses.
Mimi naona watu yote tunafurahia, sababu hiyo ni mradi kubwa sana, itatusaidia katika Matisi.
At the same time, we have another program that came about because of the needs of this community during the COVID time, because we had many children who were at home and they were not going to school. And while they were at home, they used their times going to the cyber, using their parents' phones to access something to keep them busy. And some of them were not even knowing what they were browsing or what they were involving themselves into.
Tulikuwa tunafanya mikutano, tunakutana na watoto wasichana, tunawaongelesha, lakini wengi walipata mimba. Na wavulana wengi walirudi kwa kufuta bangi, kukunywa pombe, wengi wakaharibika.
Many girls became pregnant and they went through a lot of issues, and because there was abuses within the family setting and in the surrounding. An need assessment was done how the girls were doing, and what we came up with is that these girls needed some education, they needed some empowerment, and especially on ICT, so that they can be able to make a decision on what they were involving themselves in, or what they would be involving themselves in future when they are using phones and when they are using all digital gadgets. The survey targeted at the digital education. It also targeted at the advocacy and the mental health of the girls.
Kwa hivyo tunashukuru wakianzisha hii digital divine ya vijana, itatusaidia. Kwa sababu watoto wengi wakiwa busy, hawatakuwa idle, wafanye mambo ya usharati na kupata mimba.
And for this reason, the sisters are going to set a lamp, and we will educate young girls from age 8 up to 20 years. They'll be involved, they'll be educated, so that to know and to be aware what is there in the ICT, and even to know what is all about computers and all the digital devices.
The Good Shepherd Sisters are changing the world one community at a time.